Hello everyone, let's learn about pain management. Opioid analgesics. Weak opioid drugs. Weak opioid drugs are opioid drugs for mild to moderate pain. Codeine. Pharmacology. Active orally, subcutaneous, intramuscular, metabolized in liver, excreted in urine. Duration of action 4 to 6 hours. Ineffective with poor or blocked metabolism. Indications: mild to moderate pain, diarrhea, cough. Cautions: severe hepatic or renal impairment, other causes of CNS depression. Codeine. Adverse effects: qualitatively similar to morphine, generally mild dose. Analgesic 30 to 60 mg orally every 4 to 6 hours. Antitussive 8 to 20 mg orally for every 4 to 6 hours. Dose equivalence: 240 mg orally is equivalent to morphine 30 mg orally. Preparations: tablets, syrup, injection. Combined preparations with aspirin, acetaminophen or NSAID. Some combined preparations have subtherapeutic doses of codeine. Tramadol. Pharmacology: active orally, subcutaneous, intramuscular, intravenous. Actions: opioid agonist, monoamine reuptake inhibitor, metabolized in liver, excreted in the urine. Duration of action 4 to 6 hours. Indications: mild and moderate pain. Contraindications: patients taking monoamine oxidase inhibitors, serotonergic agents. Tramadol. Cautions: severe hepatic or renal impairment, epilepsy, drugs that reduce seizure threshold, risk of serotonin syndrome. Adverse effects: qualitatively similar to morphine, generally mild, less constipating. Dizziness, postural hypotension. Uncommon: neuropsychiatric syndromes, serotonin syndrome. Tramadol. Dose: 50 to 100 mg orally for every 4 to 6 hours, or 100 to 200 mg sustained release orally for every 12 hours. Dose equivalence: 100 mg intramuscular is equivalent to morphine 10 mg intramuscular. 300 mg orally is equivalent to morphine 30 mg orally. Preparations: immediate release capsules, sustained release tablets, injection. Strong opioid drugs. Strong opioids are opioid drugs for moderate or severe pain. Buprenorphine, diamorphine, fentanyl, hydromorphone, methadone, morphine, oxycodone, pethidine. Morphine. Pharmacology: active orally, per rectum, subcutaneous, intramuscular, intravenous, spinal and topical. Metabolized in the liver, excreted in urine. Duration of action 3 to 4 hours. Longer with renal impairment. Indications: moderate and severe pain, dyspnea, cough, diarrhea. Contraindications: genuine morphine intolerance. Morphine. Cautions: renal impairment, severe hepatic dysfunction, significant pulmonary disease, other causes of CNS depression, old age, debility. Adverse effects: neuropsychological sedation, drowsiness, confusion, narcosis, coma, dysphoria, and psychotomimetic effects, myoclonus, meiosis. Morphine. Gastrointestinal: dry mouth, nausea, vomiting, delayed gastric, emptying, constipation, biliary colic. Respiratory: suppression of cough reflex, respiratory depression. Cardiovascular: postural hypotension, urological, urgency, retention. Morphine. Dermatological. Flushing, sweating, pruritus. Dose. No standard dose for chronic pain. Titrated against pain and adverse effects for each patient. Preparations, tablets, capsules, mixture, immediate release and sustained release, injection. Pethidine. Pharmacology. Active intravenous, intramuscular, orally, per rectum. Metabolized in the liver, excreted in the urine. Duration of action 2 to 3 hours. Indications moderate and severe pain. Not recommended for chronic usage in palliative care. Contraindications. Patients taking monoamine oxidase inhibitors. Renal impairment. Pethidine. Adverse effects. Qualitatively similar to morphine but less constipating. Not antitussive. CNS toxicity due to norpethidine accumulation. Agitation, tremor, sedation, narcosis. Myoclonus, seizures. Dose. Not recommended for chronic usage. Pethidine. Dose equivalence. 75 mg intramuscular is equivalent to morphine, 10 mg intramuscular. 300 mg orally is equivalent to morphine, 30 mg orally. Preparations. Immediate release tablet injection. Pethidine is not recommended for chronic pain because of its neurotoxicity and shorter duration of action. Thank you, my friends.